Good morning, doctor. Today I'm going to talk about Johnson& Johnson and Pfizer companies. They are medical companies. Johnson& Johnson was founded by Edward Johnson and James Johnson and Robert Johnson in 1896, 86. And Pfizer was founded by Charles Pfizer and his cousin Charles Edward in 1849. First, I'm going to establish a point that the decision making is centralized in the headquarters of each company, and this decision is followed by all branches around the world. So, COVID 19 is a health crisis, a pandemic. A new virus came from coronavirus family. It transformed from a health crisis into an economic crisis due to the spreading social distancing, which closed all the companies and it brought the economy to its knees. First, I'm going to talk about Johnson& and Johnson CSR initiative and strategy. Johnson& Johnson is trying to achieve a certain strategy and initiative to accomplish some SDGs goals. I'm going to state some of the SDG initiative, CSR initiative and sustainability initiative. They are trying to give support and tools to enable a healthy future to 60 million women and children around the world. They are trying to give access to safe and initial and timed surgical care to 50 million people. They are trying to give to 175 million individual the benefit from Johnson & Johnson solution that prevent, control, and eliminate global diseases. And finally, they are trying to give to 650,000 health workers better training to deliver quality health care. Johnson & Johnson and Pfizer are trying to achieve some certain SDG goals, like I said, good health and well-being. The both company is trying to achieve this goal, this goal, due to there are medical companies. They also are trying to achieve gender equality, clean water sanitation, and industry innovation and infrastructure, sustainability, cities and communities, partnership for the goals, and responsible consumption and production. Uh, Pfizer is trying to give a healthy life to all the people. They are trying to give access to medical initials and tools for the materiality analysis to the triple bottom line. Johnson and Johnson in the environment section are trying to be an eco environment friendly. They are doing campaigns for the environment, and they are targeting the life on land and good health and well-being SDG goals. For the social, they are trying to give women and children health. They are trying to fight the gender inequality and quality education for the SDGs. And for the governance, they are trying to work on the health workforce. They are trying to accomplish the SDG goals, decent work and economic growth. That's all. And for the Pfizer, they are trying to in the environment, they are trying to be the leading into the conversation on critical public health topic. they are trying to achieve the good health and well-being and life on land. They are also trying to make plans for the environment, to plant trees and forests, an artificial one. For the social, they are trying to save the newborn and children under 5 years old and deliver first in class science. They are trying to achieve good health and well being. And for the governments, they are trying to make a partnership with the government NGOs and all the partnership that they can do to help the profit in the economy. Their SDG goals or partnership with goals. And that's all for the triple bottom line. I'm going to take a break. I'm sorry. I am sorry, doctor, but I have a flu, so I can't talk too much. So, Pfizer are trying to give to 1.1 million Pfizer prescription for free to 85 million people, and they donated more than 85 million dollars for some medical pills for 15 million countries, and they are trying to achieve the same SDG goals, like I said, like Johnson and Johnson. However, Pfizer are trying to specifically achieve the goal number 3 in SDG goals, which is good health and well-being. And according to their vice president in CSR department, they are trying to focus on goal 3 because a healthy environment and a healthy country is a healthy community. For the COVID-19, Johnson and Johnson and Pfizer, they are not different. Both companies are trying to find a vaccine for COVID-19, and this is the way they are trying to fight COVID-19 and help the community. They are trying to find a vaccine. However, Pfizer has made a quite result, a good result in being so close to find a vaccine for COVID-19, which is believed to be released in 2020 September. However, Johnson and Johnson also is making a good progress. They are going to start a human trial on the vaccine on the people for the vaccine of COVID-19. Both companies, however, made another way to fight COVID-19. Johnson and Johnson have made a live campaign which named Road to Vaccine. They give a live episode each week on the progress of COVID-19, and they are answering all the questions on COVID-19. Pfizer have made until now 3 different campaigns, which are support the people. It say, however, they were going to give free pills, free medication to all the people under the income of $100,000 in the year. Another campaign was a thank you campaign, thanking everyone in the front line, the doctors, the grocery shop owners, everyone. And the last one, the science will win. They are saying that the science will win over this pandemic, over this virus. That's all for the COVID 19 and how they are fighting for COVID 19. As a conclusion, the decision making, like I said, is centralized in the headquarters of each company, and this decision is followed by all the branches around the world. Um, the two companies are trying to achieve more SDG goals, and they are competing, and they are the top in the medical field. Pfizer is in the first place, and Johnson is in the third place. And this is according to the economy of each company. And for the access, and according to the access to the medicine, Johnson and Johnson come in the first place and Pfizer in the second place. So the two companies are trying to fight COVID 19 in finding a vaccine, in supporting people, in spreading awareness, and they are trying to help all the world and all the global into achieving more SDG goals. And that's all. Thank you.